ahead, Jean, and then Channing.
Hey, Jean.
Hi,
Hey, how are you?
I'm good, thanks. So this is I'm just getting started with this and I'm trying to figure out, I did the Saturday
Uh-huh.
workshop, which was great.
Mhm.
And I want to start ordering some essential oils, but I'm trying to figure out what to sort of start with. And
Mhm.
so here's my main thing, which is that I have a sort of long history of back issues, and a recent MRI showed stenosis with some, a slightly bulging disc at L3, L4, it probably doesn't matter so much. But anyway, and it seems to radiate around my hips, particularly at night when I'm sleeping.
Okay.
Like
What,
sleeping.
what part of your hips? Like the sides of your hips, or like the butt cheek itself, or like where is it hitting you?
So what I'm noticing is actually a tingling on the front outer part, particularly of my right hip, kind of where the femur meets the,
Yeah, gotcha. Yeah, okay.
femur.
Gotcha.
And it kind of goes down a little bit, the top of that area, that tingling, which I notice at night a lot if I sleep on my side.
Okay.
And then sometimes there's numbness down my legs. I'm seeing I do a lot of Pilates to
Mhm.
keep moving. Moving helps a lot. But I'm really interested in how these, the essential oils could help. So I was trying to figure out if I should get the Arthricare. I have some arthritis as well. Arthricare. I also have arthritis in my knee, but I've got that under control with a lot of hip work, actually, that's helped my
Okay.
knee.
Yeah.
But I didn't know if I should get joint relief, Arthricare. There's so many blends, and
Yeah. And they're all kind of like, they overlap a little bit, but they're specific, because there's different kinds of pain and there's different stages of pain and things like that. And
Yeah.
so, normally I would say with this, there's a pain relief neuropathic, and that is specific for nerve pain. And you described it like radiating, tingling, and it can also be sharp and stabbing, right? But in this particular case, I would actually go slightly different for a little while. I'd eventually probably come back around to that blend, but right off the bat, I'd probably go the pain relief antispasmodic.
Okay.
And we kind of want to unwind as much of the muscular tension in and around that area as possible. And like whenever you see something like this exaggerated with laying on the side, part of it is that it could be hitting the quadratus lumborum, like this big, like lower back muscle. But there's this issue that can happen that, and you kind of were alluding to it, like when you lay on your side, what can happen is there's this ligament between the head of the femur and like the pelvis or the socket.
Yes.
And when you lay on the side, it's almost like it hyperextends a little bit. It's not really hyperextending, but it's just that ligament is being irritated a little bit. And then it kind of causes a little bit of a chain reaction in the surrounding area, but the back will tighten up to try to stabilize that. And if that's been there, if that's been happening for a while, neurologically, there's a reaction that happens in the low back that it keeps tensing up to try to offset this particular issue. And it's not necessarily going to resolve the issue in the hip, but it's going to undo the effects that had in the back. And that's actually what's causing you the pain, is just that when that's stretching like that upper part of the back tenses up to try to stabilize. And like normally I would say a series of things, but I'm going to do something a little different just because of the way that you described it. Is that there's a body tonic called Digesto Calm, like somebody mentioned it a little bit earlier.
Yes, I was.
And yeah, shake that up and put that on the abdomen. It's alcohol and witch hazel base, so it dries up. Then you can put the ointment on of the pain relief antispasmodic, which would help. And then I would do a thing to deepen the breath. Anytime you have sharp stabbing pain, tingling pain, radiating pain, it actually causes the diaphragm to tighten up and the bronchioles, which directly increases the tension of the paraspinal muscles. And so you could almost say like the tension in the spine directly corresponds to the tension in the diaphragm. So if the diaphragm is a little tight, the spinal muscles are tight. And so it's not going to be the fix, but you're undoing again the effect of the sharp stabbing pain. And by deepening the breath, it lessens some of the pain and it takes some pressure off the nerves because it's kind of continually loosening up the spinal muscles. And that you'll just inhale. So you'll do hyssop as an inhalation, right? And for this, I would probably go hyssop decumbens. Like if you just had normal hyssop, then I'd say just use the normal hyssop. But if you're having to get one, go decumbens. Decumbens has a bit more of an antispasmodic effect on the diaphragm. And then the pain relief antispasmodic, which you're going to apply to that low back area. You can apply to the hips too if you want, but I'm really like looking at that lumbar area, like kind of even like from the spine out a little bit. So can still be upper hip, could still be whatever, and then the body tonic on the abdomen. I'd start with that and see how that treats you. I would guess that that's going to calm a lot of stuff down. We still might need to treat a couple other little things. Like sometimes you treat it for a little while and you can move on to something else.
Yeah.
And so let's see how this treats you. But like that's a really good starting point for especially when you have an issue like that that's aggravated by laying on your side. Part of it is this little ligament issue. And forgive me, there's a name for it. It's I was trying to recall it when I was first thinking of it, and I'm like not even close. Sometimes you're like, it's almost there. It's not even almost there. Yeah, it's in my notes somewhere, but I can't remember what the name of it is. It's not like tendonitis is the tendon, and so ligaments can get irritated too. But it has a very specific little name, and I mean it's nothing that ever gets usually diagnosed, but it is like usually who diagnoses it is an orthopedic guy, like an orthopedic doctor.
Yeah,
like
I'm seeing
because they're looking for stuff like that. Like a GP is not going to nail it, or
I'm seeing fairly regularly a physiatrist.
Oh, nice.
For my back,
yeah.
And he proposed if it got bad a cortisone shot, but I was trying to avoid that as long as.
So I mean, you can increase cortisone in the body with oils, but I would try this first. Like if you do want to augment that, so like 3-4 drops of Sylvester pine, like not any of the other pines, like Sylvester pine. On the wrist, like put like a few drops on the wrist, like daily, and you'll just rub them together like that, and it will increase your body's production of cortisone.
Oh, okay.
Yeah,
that's awesome.
Yeah.
I mean, the thing, and I'm also taking CBD.
And, sure, that's fine.
And a gabapentin to sleep because
that's fine. That's fine.
So should I just keep with that?
Well, the gabapentin is also going to calm down sensory nerves, so. I'd still probably, you're on that medication, I'd still probably do this, but eventually what we could do, I would say, let's get this calmed down.
Yeah.
But eventually what I would do is I'd probably have you use either in salt baths or in a body tonic, sage.
Oh,
And
okay.
sage, like, and just like you're gonna rub it like all over your body, like say like at night before you go to bed.
Yep.
And part of the issue is it does hit the thalamus up in the brain, which is kind of like a processor of like stimuli, and but it calms all the sensory nerves down in the body. So it's not quite like gabapentin, but it's trying to do something similar that the gabapentin is usually prescribed for.
Okay. But I should wait to do that.
I would probably wait because I'd like to see how this treats you rather than just throwing everything out. Like that's
Right.
an issue, but like it's almost like there's a couple of these different things that they're overlapping. They are connected, but I think if we get the back stabilized, then when it comes time to calm down the sensory nerves, we calm them down, they'll probably stay calmed down. But if that
Great.
back is still aggravated, we'll calm them down and then we'll just like pop right back. And so
Yeah.
like I would say let's focus on stabilizing the back. And then next wave is we go through and like calm down the sensory nerves and maybe stimulate a little lymphatic function and things like that. But let's do this first piece. Yeah.
Great. Okay, thank you.
And deepening the breath. So hyssop, the pain relief, antispasmodic, and
Yep.
then the what was the other thing I said?
I've got digestive calm.
Yeah, digestive calm. It's not my normal protocol for something like this, but it's for what you're talking about. It should be quite helpful.
Digestion's been a factor too, so I was.
Well, it will help. It will help calm down the smooth muscle of the gut, but in doing so, it also relaxes the psoas, which is
Yes,
your
which is in the
big
shoulder.
hip flexor.
Yep.
And with everything we have going on, we want to relax that hip flexor.
Yep, no, definitely the hip flexors are really tight.
Yeah.
So that's awesome. Okay, digestive calm, pain relief, antispasmodic, and hyssop. Cucumbers. Okay, I'll start with those. Thank you so much.
You're so welcome.
Okay. Happy holidays.
You too. Merry Christmas.